CNA Exam 2024. Question 1. Which of the following is considered a HIPAA violation for a CNA? Discussing a resident's condition with another CNA at the nurse's station. Discussing a resident's condition with the nurse assigned to that resident. Discussing a resident's condition with a family member when the resident has signed a release form. Releasing information to the resident's insurance provider when authorized. HIPAA violations occur whenever you share a resident's information with someone who does not need it for their care. Discussing a resident's condition with other CNAs who are not involved in that resident's care violates confidentiality. Even at the nurse's station, conversations should be limited to those with a need to know. Question 2. A resident has an indwelling urinary catheter and the drainage bag is empty after 6 hours. The CNA should irrigate the catheter. Report the low urine output to the nurse immediately. Encourage the resident to drink more fluids. Milk the tubing to see if urine will flow. Low urine output, less than 30 milliliters per hour, or empty after 6 hours, may indicate dehydration, kidney problems, or a catheter obstruction. Report this to the nurse immediately. CNAs should not irrigate catheters or manipulate tubing beyond routine care. Question 3. Which of the following best describes how persons affected by Parkinson's disease typically walk? They tend to walk quickly. They tend to lean back when walking. They walk normally but with some shakiness. They shuffle their feet while taking small steps. Parkinson's gait is characterized by a shuffling walk with small, rapid steps, festination. Residents may also have a stooped posture, decreased arm swing, and difficulty initiating movement. Postural instability increases fall risk. Question 4. Which is not a reason why a CNA should refuse an assignment? The CNA is upset because of a personal conflict with the patient's family. The CNA believes the task is unethical. The task is outside the CNA's scope of practice. The CNA has not been trained to perform the task safely. Personal conflicts with a patient's family are not valid reasons to refuse an assignment. Valid reasons include tasks outside the CNA's scope of practice, tasks the CNA has not been trained to perform, situations that are unsafe, or tasks the CNA believes are unethical. Question 5. A resident has a family member who visits daily but tends to upset the resident. The CNA should refuse to let the family member visit. Discuss concerns with the nurse, who will work with the resident and family. Tell the resident to stop having visits. Escort the family member out of the building. Residents have the right to have visitors, even if those visits are difficult at times. The CNA should not restrict visitors. Report concerns about family visits to the nurse, who can assess the situation and work with the resident and family to find appropriate solutions. Question 6. You overhear another staff member say to a resident, "If you don't stop calling me, I'll smack you." What should you do? Tell the staff member that you overheard and it's not okay. Report the threat to the nurse immediately. Stay out of it since it doesn't involve you. Tell the resident not to press the call light so much. Threats against a resident constitute verbal abuse. CNAs are mandatory reporters and must report any suspected abuse, including verbal threats, immediately to the nurse. Do not confront the abuser yourself. Failure to report could result in disciplinary action and loss of certification. Question 7. A resident is eating and suddenly cannot speak, cough, or breathe. The resident appears panicked and is clutching their neck. This is a sign of a heart attack, a stroke, severe choking requiring the Heimlich maneuver, a seizure. The universal sign of choking is clutching the neck with one or both hands. If the resident cannot speak, cough, or breathe, the airway is completely obstructed. The CNA should call for help and begin abdominal thrusts, Heimlich maneuver, immediately. Question 8. A CNA is asked by a family member about another resident's medical condition. What should the CNA say? Share the information because family should know. Politely decline and refer to the nurse. Look up the information in the medical record and share it. Tell the family to mind their own business. A CNA must not share medical information about one resident with another resident's family member, as this violates confidentiality. Politely decline to share any information and refer the family member to the nurse. Question 9. A CNA walks into a resident's room and finds two consenting residents engaging in sexual activity with the door closed. The CNA should report the incident to the nurse as inappropriate behavior. Close the door quietly and respect their privacy. Tell the residents that this is not allowed in the facility. Stand in the room and monitor until they stop. Consenting adults in a long-term care facility have the right to sexual expression and privacy. If no abuse is occurring and both parties are consenting, close the door and respect their privacy. Do not interrupt or report unless there are concerns about consent or capacity. Question 10. You are caring for a diabetic resident who you find sweating and is only able to mumble words. What is your initial step? Give the resident orange juice if they can swallow. Call 911 immediately. Report the symptoms to the nurse immediately. Wait a few minutes to see if the resident improves. Sweating, confusion, and difficulty speaking are signs of hypoglycemia, low blood sugar, a medical emergency. Report this change to the nurse immediately. Do not give any food or drink unless the nurse instructs you to do so, as the resident may not be able to swallow safely. Question 11. Which of the following is a possible sign of a heart attack and should be reported to the nurse immediately? Complaint of heartburn after eating spicy food. Chest pain or pressure that may radiate to the arm, neck, or jaw. A temporary feeling of fatigue. Mild shortness of breath after walking. Chest pain or pressure that radiates the arm, neck, jaw, or back is a classic sign of a heart attack. Other signs include shortness of breath, nausea, cold sweat, and lightheadedness. Report these symptoms to the nurse immediately. Heart attack symptoms should not be assumed to be indigestion. Question 12. What is the safest action if you are unsure whether a task is allowed? Perform the task anyway and hope it is correct. Ask the nurse for guidance before proceeding. Refuse the assignment without explanation. Ask the patient if they think you should do it. Do not perform any task if you are unsure whether it falls within your scope of practice. Ask the supervising nurse for guidance before proceeding. Staying within your scope of practice is one of the most important legal expectations for CNAs. Question 13. A resident has a signed advance directive, living will, stating they do not want CPR. The resident's heart stops. According to the advance directive, the CNA should begin CPR immediately anyway to save the resident's life. Call for help and follow the advance directive unless the family gives permission. Ask the family what they want before calling for help. Check the resident's chart for the DNR order before acting. Advance directives must be honored. If a resident has a signed do not resuscitate, DNR, order or advance directive, do not begin CPR. Call for help, and care will be provided according to the directive. Unless you personally verify the code status in the medical record or with the nurse, check before acting in a code situation. Question 14. When are side rails considered a restraint? When both side rails are raised. When one side rail is raised. When side rails are raised to prevent the resident from getting out of bed independently, against the resident's wishes. Side rails are never considered a restraint. Side rails become a restraint when they are used to restrict the resident's freedom to move independently, without a physician's order. The FDA and OBRA regulations encourage the use of half or quarter rails to assist with repositioning rather than full rails that trap the resident. Full restraints require a doctor's order and must be used only for safety reasons. Question 15. A resident has a roommate. When providing a bed bath, the CNA should always close the curtain around the bed and close the door if possible. Leave the door open so you can hear the call lights. Pull the curtain partially, but leave it open enough to see the room. Ask the roommate to leave the room. Protecting a resident's dignity during personal care includes ensuring physical privacy by closing curtains around the bed and closing the door. Even if the roommate is present, use curtains to create visual privacy. Dignity and respect are fundamental rights. Question 16. What immediate steps should a CNA take upon recognizing that a client is showing signs of choking? Ask the client to keep coughing and bring them a glass of water. Call for help and perform abdominal thrusts, Heimlich maneuver. Lay the client down and check the mouth for food. Leave the room to get the nurse immediately. When a client is choking and cannot speak, cough, or breathe, immediate action is required. Call for help, then perform abdominal thrusts until the object is expelled or the client loses consciousness. Do not leave the client unattended. Question 17. A resident keeps $100 in cash in their bedside drawer. The CNA observes another staff member looking in the drawer. The CNA should say nothing, as it's not your business. Report your observation to the nurse immediately. Ask the resident why they keep cash in their room. Tell the other staff member to stop looking. Residents have the right to manage their own finances and personal property. If you observe staff acting suspiciously around a resident's belongings, report the observation to the nurse. Suspected theft of resident property must be investigated. Question 18. Which of the following is considered a normal age-related change seen in elderly residents? Increase in appetite. Decrease in constipation. Decrease in taste, sensation and smell. Increase in amount of confusion experienced daily. Decrease in taste, sensation and smell is a normal age-related sensory change. Increased confusion is not normal and should be reported to the nurse as it could indicate infection, especially UTI, dehydration, medication side effects, or other medical conditions. Question 19. What needs are found on the lowest level of Maslow's hierarchy of needs? Love and belonging. Self-esteem. Safety and security. Physical, basic survival needs. Maslow's hierarchy places basic physical needs, food, water, shelter, sleep, at the lowest level. These must be met before a person can focus on safety, love and belonging, self-esteem, and self-actualization. CNAs help residents meet these basic physical needs every day. Question 20. A resident asks the CNA, "What do you think is wrong with my skin?" The CNA's best response is, "That looks like a rash, you probably need cream." "I don't know. I'm not qualified to diagnose, but I will report your skin to the nurse so they can assess it. It's probably dry skin from the winter." CNAs are not qualified to diagnose medical conditions or give medical advice. The appropriate response is to acknowledge the resident's concern, report it to the nurse for assessment, and stay within your legal scope of practice. Never speculate or offer medical opinions.